Welcome to Early Career Insights, Enduring Impact, using graduate outcomes and workforce data to shape academic public health. My name is Emily Burke. I am the Senior Director of Workforce Development and Applied Practice at the Association of Schools and Programs of Public Health. I am delighted to introduce today's presenters and panelists. Maddie Papalis is a senior research associate at the Beaumont Foundation, and Maddie focuses on the Public Health Workforce Interests and Needs Survey, which you all probably know as PHWINS. Dr. Erin Bell is the Dean of the College of Integrated Health Sciences at the University at Albany State University of New York. The College of Integrated Health Sciences was established in 2024 and includes the School of Social Welfare and the former School of Public Health. It continues its 40-year partnership with the New York State Department of Health and brings together expertise in nursing, public health, biomedical sciences, and social welfare to train the next generation of public health, nursing, and social work professionals. Michelle Davis is the Deputy Commissioner of the Office of Public Health at the New York State Department of Health. Michelle is an experienced civil servant with over 20 years in public health at all levels of government in the US, the Caribbean, and in Africa. Ms. Davis previously served as a special advisor for the former Health and Human Services Assistant Secretary for Health. Erin Norrell is the Associate Director of the Division of Public Health Infrastructure at the New York State Department of Health, where she supports the Office of Public Health's vision to increase the size and diversity of the public health workforce, increase the visibility of the Office of Public Health, and strengthen community-based partnerships. And last but not least, we have Joanne Morn, the Executive Deputy Commissioner and previously the Deputy Commissioner of the Office of Health Equity and Human Rights for the New York State Department of Health. Ms. Morn was appointed in August 2022 as a member of the department's cabinet to lead the department's health equity and human rights planning, policy development, and programming. Thank you all for being here today. Now, to get us started, I want to talk briefly about public health graduate outcomes. And as many of you know here today, ASPPH has collected data from our schools and programs of public health since 1974, including data on applications, students, and graduates. And we have about 10 years of graduate outcomes data. So over the past 10 years, over 200,000 graduates have entered the field. And in 2024, just under 27,000 students graduated from ASPPH member schools and programs of public health. For a period of time, we thought that the largest cohort of graduates would be undergraduates, but it turns out that trend reversed during COVID, and master's level grads continue to be the largest group of students. And in 2024, just over 16,000 students graduated with master's degrees. And they either landed in employment, continuing education, fellowships, internships, volunteer or service programs, and some of them, a very small percentage, unfortunately, were still seeking employment. But you can see here that for bachelor's degree graduates, about 30% of them landed in a continuing education program. That's about 10% for master's level. And then the vast majority of our master's and doctoral students end up employed. But where are they working? So for our undergraduates who enter the workforce, we know that 30% of them over the past 5 years have landed in healthcare, with 24% landing in for-profit. So over half of our bachelor's degree holders end up in healthcare or for-profit. Unfortunately, we don't have a significant amount of detail about what those organizations or companies are. So I can't tell you if for-profit means Starbucks, but I can tell you that this is different from what we're seeing our other degree levels where they are landing. You can see here that our master's level graduates, the largest employer does continue to be healthcare. However, government agencies, including federal, state, local, tribal, and territorial, is the second largest employer of our master's level graduates. And finally, our no surprise here, our doctoral level graduates end up in academia. And I just wanted to give a little bit of that level setting before I hand it off to Maddie to walk us through the public health wins results. And in case you're asking, what do our graduates do once they get to their employment? I can tell you that we're not sure. And that's because academic public health does not have a standardized data collection that follows graduates' career paths. But I am very committed to making that happen. So if you're interested in talking about that, please email me. And Maddie, off to you.
Thank you. I am really excited to talk to you more about how we can use PHWin's data to talk a little bit more about academic public health. So first, I'll just introduce the Beaumont Foundation. If you're not familiar, the Beaumont Foundation is a private foundation that's focused in improving public health across the United States. We are based in Bethesda, Maryland, which is right outside of Washington, D.C. A few objectives that I have for the slides today are to first either refresh your memory or learn the basics of PHWINs, and then to look a little bit more into the characteristics of government public health workers who have public health degrees and how they're different from their colleagues without public health degrees, to identify some areas that are strengths and areas for improvement among those employees with public health degrees. And then finally, to take a little bit of a deeper dive into our early career professionals who are about age 35 and under and how they got to government public health. So PHWINS, or the Public Health Workforce Interest and Needs Survey, is the first and only nationally representative survey of state, local, and territorial government public health workers. So what that means is that PHWINS is fielded a little bit differently than other surveys that you might have heard of. You might know the ASTO or NACCHO profiles, where one person is reporting out about their agency. But PHWINS is conducted at the individual level. So when an agency signs on to participate, the health official agrees to it, and then they send us the list of all of their employees at their agency along with their emails. So then when we launch the survey, every employee receives a survey link to take it. So we're able to have give everyone the opportunity to share their experiences. The survey itself is conducted in collaboration between ASTO and the Beaumont Foundation, and we field it every 3 years. It started as a pilot survey in 2014, and then again in 2017, 2021, and then most recently in 2024. So that means just last year we celebrated 10 years of PHWINS. The survey itself is generally focused on recruitment and retention among the public health workforce. And the 5 main topic areas that it covers are workforce characteristics, workplace engagement, training needs, workplace infrastructure, and demographics. And that 4th category there, workplace infrastructure, is actually a rotating section. So with every cycle of PHWINS, we change out the questions to try to address something that's pressing within the field at the time. So last year, or in 2021 rather, we focused on racism as a public health crisis. And then this year in 2024, we focused on workplace infrastructure because we wanted to focus a little more on things that are internally changeable within an agency. So those policies related to benefits and remote status and things that there's a little bit more control from the agency. And then this round, in 2024, we also added some special topic modules. So those had a few more questions for specific populations so we could get a little bit of a better idea of their unique experiences in the workplace. So we covered staff who are 35 years old or under, supervisors, and epidemiologists. And a little bit later on, I'm going to go into some of the data we got from that first module of 35 years old or under. PHWINS 2024 started fielding in September of 2024, and then it was open through January of this year. This was our largest survey to date and was distributed to nearly 160,000 employees. We had representation across 48 state health agencies and about 1,200 local health departments across 48 different states. So you can see that represented on the map over there on the right. The green represents state health department participation, and then the little dots represent local health department participation. So overall, this resulted in 56,595 responses to the survey, which was a 37% response rate. So now I'm going to turn a little bit more to the data. This is going to be very data heavy, so I apologize in advance, but I'll try to keep it interesting. I'm going to do some comparisons between people with public health degrees and those without, and then some of the slides will just be for the information related to people with public health degrees. So I'll start off with just doing some employee characteristics and demographics. Overall, what we saw was that 22% of employees in the survey had formal public health training. And what we consider that to be is a public health degree, either at the associate's, bachelor's, master's, or doctoral level. And this accounted for about 12,000 responses overall in the survey. And then on the right side there, you'll see the comparison between people with public health degrees and people without public health degrees and where they're working. We see that there's people with public health degrees are more likely to be concentrated in the state and large local health departments. So this could be for a lot of different reasons. It could be that state and large local health departments just have more funding and more resources, and they employ more people for public health functions versus smaller local health departments, which maybe don't have as many resources and sometimes tend to have more clinical focuses. We also will find out later that people with public health degrees are generally younger. So it could be that younger people are more likely to live in or desire to live in cities where state or large local health departments are located. So this graph is a little bit confusing, but what you'll see on the left side is the breakdown of degree type among public health degree holders. And these bars are not mutually exclusive. So you'll see that adds up to more than 100%. And that's just because oftentimes employees will have more than one public health degree. We did see that about a third of people with public health bachelor's degrees also held public health master's degrees. But you'll see here that this kind of matches up with what Emily was showing, that a larger percentage of those people with master's degrees end up in government public health. And that's kind of represented here in this graph as well. And on the right side there, you'll see the top concentrations among people with master's and doctoral degrees, that they are the same for the top three, and then they just change for the bottom two, but a large percentage of them just in general are focused in epidemiology. A majority of people with public health degrees in state and local government fall into this kind of grouped category here, which are generally public health programs, research, assessment, and surveillance. So that's kind of a mouthful, but that's generally just jobs that fall into what we would consider to be public health core functions. We see that some do fall into the staff and leadership category and some into the clinical, but the bulk of them are in that public health category, that blue bar there on the left. And on the right there, we see that about a third of people with public health degrees hold supervisor, manager, or executive positions. And just because this is a cross-sectional survey, we don't have enough data to say if that's more people with supervisory level status jobs are more likely to get public health degrees, or if people with public health degrees are more likely to move up in the workplace. We can't really say one way or the other. But I think that's an interesting fact either way. And so this is what I was talking about a little bit earlier. We can see here the orange bars are people with public health degrees, and then those navy bars are people without public health degrees. So this just shows the age breakdown across the workforce, and we'll see that the orange bars are more concentrated towards the left because about more than 50% of people with public health degrees are 40 years old or younger. So shifting gears a little bit, we're going to talk more about how we can support the workforce, specifically people with public health degrees, what their needs are, what their preferences are, and what their retention looks like. So the words and the numbers on this are a little bit small, so it's kind of a lot of information. But again, the people with public health degrees are the orange bars, and the people without public health degrees are the navy bars. And these represent the training needs of the workforce. The way that we assess training needs in the survey is that respondents are given a list of about 25 different skills, and they first rank the importance of those skills to their job on a scale of not important to very important. And if those skills are moderately or very important, they are then asked to rank what their skill level is for those items. So they rank those on a scale of not able to perform, beginner, proficient, or expert. And something is considered to be a training need if it is moderately or very important to their job, but they have a low proficiency at that skill. So they're either a beginner or not able to perform those skills. And so generally what we see here, oh, sorry, I just have a few more things about that. Thank you. Generally what we see here is that training needs are less intense among staff with public health degrees, which likely means that they're better equipped to do the technical aspects of their jobs. Notably, though, we do see that policy engagement, community engagement, and database decision-making are significantly lower than those without public health degrees. So they're performing a lot better in those categories. However, we do see that there's still room for improvement because more than 50% report a training need in budget and financial management. And then about a third report a training need in policy engagement, systems and strategic thinking, and change management. So we typically think of those skills as kind of the strategic skills, and those are things that potentially are needed for advancement in the workplace. So what this is showing us is that public health degree holders have solid technical expertise, but they might struggle with skills like leadership, understanding funding streams, and seeing the bigger picture. So I think this shows us that there's a better opportunity for us to train people with public health degrees, and then more specifically, people who are young professionals in those strategic skills in order to build a stronger workforce. Unfortunately, across the board, we do see a pretty high level of burnout amongst government public health employees, and particularly of those that have public health degrees. So we see that 77% report one or more symptoms of burnout, and about a quarter report constant symptoms of burnout. And these numbers are a little bit higher than we see in the folks without public health degrees. And it's also particularly higher amongst those who are 35 and under. So we see that 88% report one or more symptoms of burnout. And overall, nearly 1 in 5 report they have a poor or fair mental and emotional well-being. So there's a clear and present issue for both young professionals, people with public health degrees, and the workforce overall to improve burnout and well-being within the workplace. 28% of public health degree holding staff are planning to leave their positions within the next year. And this is higher than what we see for staff without public health degrees, which is about 20%. The bright spot there is that about 70% of those who plan to leave their positions plan to stay in public health as a field, whether that's in government or not. And that's much higher than those who do not hold public health degrees. So the dark blue bar, the kind of navy bar, and then the bright blue bar are the two categories where they would be planning to leave to stay in public health. So those are the bigger chunks. And then on the right side, we see the top reasons for leaving. And I specifically wanted to highlight that lack of opportunities for advancement and work overload and burnout are on this list. And I think these are issues that we can potentially hit from both ends. By helping students when they're still in their degree programs, help to develop like strategic skills that they need for advancement to leadership roles. So perhaps they would have a better, a clearer pathway to advancement in the workforce, and maybe even be able to manage their workload a little bit better with those strategic skills. And we also need to create more supportive environments for employees within the workplace so that they have clear pathways for advancement in the workplace as well. Not just to focus on the negative things, there's also a lot of positive things. There are a lot of benefits that people have working in government public health. On the left side, you'll see the top reasons for staying are benefits, job stability, satisfaction with your supervisor, support from your colleagues, flexibility, and job satisfaction in general. And on the right side, we'll see that people are generally pretty positive about the policies and practices that are in place within their agencies. So 85% feel comfortable using their PTO, 76% are able to complete their work within working hours, and 70% say that their agency implements policies and practices that support their mental well-being. And although these numbers are pretty high, so I think that implies a pretty positive support of their agency. It'd be great if they were 100%, so I think there's still some room for improvement, but I would say generally that's a pretty positive indicator for the workforce. What you're looking at here is people with public health degrees. The orange bars are showing you what their preferred remote status is, and then the gray bars are showing you what their actual remote status is. And generally what we see here is that public health degree holders and pretty much the workforce overall prefer a hybrid work environment with some in-person and some remote work. And I think this is particularly important because 34% of those people who were considering leaving in the next year were citing remote work policies as a reason that they were leaving. And 22% reported a lack of flexibility, so things like flex hours or telework, as a reason for leaving as well. So this could be a helpful strategy when we're thinking about recruitment and retention of people in government public health. Overall, with people who have public health degrees, we see that there is a real big importance for these non-traditional benefits. And again, the words are a little bit small here, but we can see that flexibility and education support are the most important ones. So we see that flex time, professional development funds, ad hoc remote work, and student loan repayment or forgiveness have the highest percentages for importance among this group. But generally overall, we saw that these numbers were a lot higher for people with public health degrees compared to those without public health degrees. Switching gears a little bit, we're going to be talking about pathways to government public health, and specifically talking a little bit more about employees who are age 35 and under and some of those questions they were asked in the module that I mentioned earlier. So we see that more people who have public health degrees are joining government public health straight from school compared to those without public health degrees. But we are seeing that a large percent are coming from a different job first. So they're getting their degrees, getting a different job, and then coming to government public health. So that's about 60% are still coming from a different job. And we see almost 30% are coming straight from school. And then from those jobs, on the next slide, you'll see that there's kind of a breakdown of people coming from non-governmental jobs, government jobs, non-public health jobs, and public health jobs. But you'll see that it's much higher for people with public health degrees for them to be coming from public health jobs, whether that's in government or in not in government. So you'll see the furthest bars on the left represent government jobs in public health. And then the third ones are non-government jobs in public health. And so there is not always a clear pathway for advancement within the public health workforce. So what we see on the left there is about 45% of employees with public health degrees who were age 35 and under said that they did not see a path for development, or they weren't sure if there was a path for development within their agency. So I think that's a pretty big chunk of those folks. And on the right side of this, you'll see that 43% of public health degree holders who were 35 years old or younger cited lack of opportunities for advancement as a reason for leaving their previous position. So those people who were on that last slide and they were coming to government public health from a different job, 43% of them said that they left that job due to a lack of opportunities for advancement. So we asked respondents who were age 35 and under what the top factors that drove them towards public health were, and we overwhelmingly found that benefits and mission-driven work are what motivated young employees to their position. This was especially true for those who held public health degrees. That's what you'll see on this graph here. 74% cited the ability to serve their community and do meaningful work. as a top reason for joining government public health, compared to 60% of those without public health degrees. And then the navy blue bar at the bottom, 52% said that they joined government public health because of personal satisfaction that the job gives them, compared to only 45% of those without public health degrees. So overall, what I think these data are telling us are that public health degree holders are well equipped to handle technical challenges within the workplace. So handling those core public health functions, but they sometimes can lack strategic skills that can support their advancement within the workplace. And many of them also don't see a clear opportunity for advancement within their jobs and within their agencies. And we know that that's vital for their retention, both within the agency and within public health overall. We also see that retention hinges on more than just pay. We know that pay can sometimes be a hard thing to change. You can't always change the pay scales that people fit within, but you can change some things like flexibility, benefits, and purpose-driven work. And because we know that those are major factors in keeping talent. Some implications that I see for these for public health as a field is that it's really important for us to start trying to close those skill gaps across both education and within practice to help public health professionals not only be mission driven, but also have the skills that they need to lead effectively in the public health landscape, which we know is always changing. And also by creating and communicating clear pathways for advancement in the workplace, especially for retaining early career professionals and people with public health degrees so that we keep that talent within the public health system. And then I just wanted to plug really quickly, next week, we'll be launching our PHWINS dashboards. They are new and improved, so there's a lot of new functionality on these where you can filter the data in different ways. You can link to different resources. So if you found something that was particularly interesting in this presentation, but you want to look at it by a different population, so say you want to filter by people with public health degrees, but you want to look at that by race and ethnicity, you can do both of those things on there. So we are really excited about that. We're going to be launching them next week at the NACHO conference. If anyone's going to be there, we would love to have you. And that is all I have. So I will pass it back to Emily.
Thank you very much, Maddie. And if I could welcome our New York colleagues to turn their cameras on, we now have some time for our panelists to provide us with some initial reactions to these findings. And Dr. Bell, would you like to kick off those initial reactions?
Sure, and thank you very much for having us today and for presenting the data. We like data, right? In public health, and as an epidemiologist, I particularly like data. And thank you for this. I was particularly intrigued by the findings around some of the topic areas that the younger workforce is looking for around policy and management and budget and systems thinking. And as you dug further into the data around advisement and job advancement, it's reflective of what I've heard from some of our own students and who are now working, that with the mass retirement that's going on right now, we've lost a lot of our institutional mentors, and we have such a close relationship with our own health department. We've benefited from those institutional mentors for so long, and now as they've decreased in numbers, it is very likely that our under 35 workforce are working with others who are also under 35 and don't have that type of natural mentorship. So I think the challenge, certainly for those of us in the dean role, is to find how do we incorporate now these academic advisement, mentorship opportunities that we don't yet have in place and haven't needed until now. And I know also in my dean role and having gone through a major change management situation in our own college for the last 2 years, that many of my faculty would not necessarily feel comfortable teaching, particularly around budget and management. And so finding ways and partnering with our local health departments and our state health departments on opportunities to provide some seminars and mentorship, I think will be important moving forward.
Thank you. Joanne, Erin, and Michelle, would you add anything?
So hi everyone. I'm Joanne Moore, and I think first of all I agree with everything that Dr. Bell has offered, and I think if I were to underscore there, the three words that I picked up from what you said included support, historian, and mentorship. And I just really want to underscore the importance and how essential mentorship is, particularly as we're now going through um, a federal transition and a transition within public health, both as we know it historically and as we anticipate it moving forward. What I want to say at the same time is that while certainly within the Department of Health, we can appreciate the loss of historians, as individuals have looked at other career paths and also retirement following our response to a pandemic, I also see it as a great space of opportunity to look at things perhaps through a different lens, to take whatever history or understanding of the past is available, and to think about, well, how could we do it differently? How can we do it more efficiently? And most importantly, how can we do it more effectively? Right. And that's not to suggest that the past weren't any of those things, but we are in a period of time now where it's really interesting and fascinating to be working in public health. And while there certainly we're faced with challenge and we're faced with question, that's not unique. I think if you were to speak to any historian, they would speak also to the point in which we as public health experts or public health enthusiasts are challenged about how we do things and why we do things. But within that is a clear opportunity for us to look at how do we advance in a changing environment, from a community level to a national level.
Yes, hi, Michelle Davis. And I have to say, I agree with Dr. Bell as well as Executive Deputy Commissioner Joanne Moore as well. Mentorship is very important, and in the number of health departments that I've worked in, I have either participated in mentorship or established mentorship programs because younger individuals need that kind of attention and the ability to obtain information that they might not obtain just working on some particular project. I think, as Joanne has stated, we're in a unique opportunity for public health at this time, and that we have a lot of opportunities for innovation because public health does have to change somewhat due to some of the restrictions and the defunding of a lot of programs. And we need to focus on collaboration more outside of public health. So, working intersectionally with other partners who can assist us with improving the health of our communities.
Hi everyone, Erin Norrell. So the only thing, I agree with everything that's said. What really struck me was actually the skills gap on that slide of those strategic skills, compared of those with a master's degree in public health or a degree in public health. What we're doing under the public health infrastructure grant from the CDC is one of the key things we're working on is identifying those skills gaps and what trainings are needed of our current workforce within the Office of Public Health and our 58 local health departments as well. So I found that slide extremely interesting. So thank you.
Great, thank you. And Michelle, I did hear you say that we need to prioritize intersectional partnerships, but I'm wondering if you all can also speak a bit to what the key academic and practice partnerships are that you believe would be critical to sustaining and strengthening workforce entry pipelines.
I would have to say that having, which you do, individuals who work in public health participate in some of your courses as speakers to give the students a more realistic picture of what we do in public health at the local level, at the state level, and even at the federal level. that would help them decide if this is the career they want, or it will allow them to say, yes, this is something that I really want to do, and they get excited about public health, as we all should be, because it's so important. Mhm. Yeah.
Thank you. Anything to add, Joanne or Erin?
So,
Yeah, I'll just,
oh,
go ahead,
ahead.
Joanne.
No, go ahead, Erin.
Okay, so prior to becoming Associate Director of the Division of Public Health Infrastructure, I was the Director of the New York State Public Health Corps Fellowship Program. And that, we bring in kind of fresh graduates. Majority of our fellows in this latest cohort came right from school. And we partnered with a number of academic institutions to get the word out before we did our call for applicants. So we had over 35 different academic institutions, had students come on and kind of learn about the fellowship and how their schooling could apply and kind of get real world experience through the fellowship. And I know the Department of Health has done a number of collaborations with academic institutions for internships. I'm proud to say under the Public Health Infrastructure Grant, we have a Pathways into Public Health internship program for schools with public health, but also broader, fields of studies to kind of increase, again, of how you can take that communications background or business degree and move, and it applies to public health as well. So I think fellowship programs and internship programs are a key strategy.
Yeah.
See, it's good that I let Erin go first, because that's pretty much exactly what I wanted to say. Every opportunity that an individual has to do the actual hands-on work as they're going through the academic process is key. And I also want to comment. So prior to working in government, I worked in the community for many years. And I didn't understand what my role could be or how the impact could be the same coming into government. It's really important to understand that there are a number of ways in which we as public health professionals can impact change and certainly provide access to life-saving programming and support. And so I just encourage everyone, while we here are a state government and we have a long-standing history of cooperative work, that there are many community-based organizations, and it doesn't have to be a formalized fellowship. It can be a volunteer opportunity. But what it is it's about learning, who are you doing the work on behalf of, and why does the work you do make a difference? And seeing it firsthand is the best way to truly understand that.
And so I'm going to tie it up in a bow. And I fully agree with Joanne in our own research that's community engaged as we work with our community partners and our community organizations and the people who are working with them. We've noticed a significant uptake and say, oh, and light bulbs go off. This is how, if I were in a government setting, how I could help have an impact or inform that policy. And that perspective is so critical, because our students and our folks coming from those community programs know what we need to do to make change, right? They're in the community, they're from the communities we need to reach the most. And so incorporating them and having them part of our mentorship and training program, and then recruiting them into government public health is critical. And so our own research, our own work, the boots on the ground, walking the streets, is really critical to recruitment and retention of our folks as we work with them.
Maddie, I'm going to throw a question over to you. So the survey results suggested that public health trained, those holding degrees are heavily concentrated in programmatic and research roles. And I'm wondering if you could speculate on potential implications for health department operations and succession planning.
Absolutely. I think this kind of ties in with what we were seeing with those training strengths and then the gaps that we were seeing. So people with public health degrees tend to work in those public health functions where they have the skills and technical expertise that they learned in their degree programs. But I do think that shows kind of a gap in those strategic skills that we kind of associate more with leadership roles. So although they have the skills to make an impact in those programs or in the research and surveillance side of things, they may not have the skills that are needed to transition into something like admin or leadership types of roles. So I think that There's opportunity to provide more mentorship, like we were just talking about, to be able for them to grow those skills. There's opportunity to kind of grow those skills within academic programs so that they can enter the workforce and be ready to transition into those roles. And I think there's more opportunity for cross-functional experiences within the workplace and maybe even in academic programs where people are exposed to not only the traditional public health roles that we're kind of preparing for in academic settings, but also for the importance of understanding the administration and the leadership side of things as well.
Great. And I imagine our DOH colleagues might want to weigh in on operations and succession planning as well.
I certainly think succession planning is very important. Unfortunately, in a number of the health departments that I've worked in, we haven't had the number of staff to actually do that type of work because we were so busy responding to, disasters or, the COVID of the week, sort of incident. But I think that that's very important, and we need to work on that and try to be more innovative to include that in the routine job activities of all staff so they can get that understanding and that experience. Yeah. And I just want to add, I know we're speaking about, the academic environment, but I think it's very important for us to begin educating our children in primary, secondary, and high school about public health as well. I really didn't learn about public health until like the last year of undergrad. And I was like, oh, maybe this is something I, might want to think about. And I think we need to at least broach that topic with them at an earlier age. And then we can work on that so that they're not shocked if they move through, they're not shocked about how public health works and what public health is. They'll know the importance.
Thank you.
Absolutely. I often say that in my career, one time someone said, oh, and Joanne Moore, who's been working in public health for a long time. And I remember thinking to myself, what's she talking about, public health? We never called public health in the community. We just understood that our work was to ensure that people had access to the things that they need in order for them to improve their health and live satisfying lives. I don't think I really appreciated the reference of public health until I came to government to understand that, in fact, the work we were doing did have a framework and did have evidence and science behind it. So it just sort of speaks to also, if a job doesn't say public health, that doesn't mean it doesn't fall within it. And that's really important for you to look at as well as you think about your career. As it relates to succession planning, one of the things that we talk quite a bit about here at the New York State Department of Health is the fact that we too have to figure out where we need to pivot and where we need to change. Not unique to this department, but as government, state agencies as a whole, that the workforce that's coming in also has expectation and has, again, sort of shown opportunity of change, right? Within looking at how we have historically worked and what we have historically expected of a workforce. So there's a responsibility on our side as well. And I think that we're taking steps to understand what a new dynamic public health workforce can look like as far as understanding that work-life balance as an example. But we still have more that we can do.
Thank you. And Maddie showed us a slide about the skills that are needed among our public health degree survey respondents. And I'm curious if, and this one's for the New York State Department of Health folks, if you've observed any misalignment between the skills that our grads arrive with and the day-to-day demands of your department. And if so, what can academic public health do to address that?
I can start. So one of the biggest things that's actually not on the list, but are soft skills. So, directing the public health fellowship program, one of the biggest pieces of feedback I got from host organizations that included local health departments and state health departments is new graduates coming into a fellowship didn't really know how to write an email. Like they're like, hey, how you doing? Instead of like, dear so-and-so. Or another big one is a lot of things, I guess, are being done in Google Docs, right? But that doesn't necessarily translate into Microsoft Office Suite, which is, you know, the key thing that we do. So it's some of those things that, those were the biggest things that were brought up to me. So we were trying to develop trainings around these soft skills, how to present, you know, or do a poster or oral presentation. And so those were big ones. I will say the Office of Public Health did a technical skills assessment as part of the public health infrastructure. So the big things that came up were technical skills, which some of them, you know, you touch upon, like administration, budget management, but soft skills came up in addition to leadership and management skills were kind of the biggest ones, and that was across the Office of Public Health. So that includes environmental health, community health, as well. So a little bit of both soft skills, but then some technical skills as well.
From the training needs slide that Erin had, I would say the budgeting and the financial management aspects, there's a misalignment there. Policy aspects, as well as the systems and strategic thinking. And the systems and strategic thinking, you know, aligns with the health and all policies concept. You know, being able to work with different sectors and to you know, come up with ideas that are unique that perhaps we haven't thought about before. So those are some skills that I think there's a misalignment of individuals coming into health departments that I've seen over time.
And I'll just continue the discussion around soft skill. I don't know if these are soft skill because they're so important to me when I watch individuals engage in the work. And I think this gets lost sometimes when you think about government. But having the ability to come into the work, whatever space you're in, whether you're focused on data and science and research, or you're focused on the direct service impact, but maintaining empathy, compassion, and the ability to compromise. Because, you know, these skills, yes, they're absolutely, in my opinion, essential to doing public health work. But they're also what gives you the opportunity when people consider you, recognizing that there are competitive spaces here for advancement, you know, and the ability to really look at how does a person, you know, oftentimes if I'm invited to a meeting, I'll ask, well, what value added am I bringing, right? Like why am I needed in this meeting? So as you're thinking about your careers, you want to ask yourself, what value added am I bringing? And that comes with the ability to know how to work within groups, to understand that it may not always be what you visioned it or what your opinion is, but as a collective, you've come to an agreement and being able to accept that and still work towards whatever the ultimate goal is. EQ. I'm a big EQ person, emotional intelligence.
That's great. Thank you. I think some of that gets to what we learned about in terms of our grads are very mission driven and they need to have purpose in their work. So a question to all of you is, we learned that yes, our public health graduates are more likely to leave their current role, but they remain very committed to the field of public health. So how can we harness that passion without losing them to other sectors?
I'm happy to start. I'll just say, for me, if I have a colleague that decides to move into, you know, the private sector or some other sector, yes, of course, there's a loss that comes from your immediate space within the department. However, I also see it as now you're bringing the knowledge of public health and whatever else has been gained while you were here into that different sector. So perhaps going back to one of the earlier suggestions, if we look at how do we work across different sectors out within and outside of government and academia, this is how it's done. You bring in that different perspective. So I think that in and of itself is a huge opportunity.
And I would say in my career, I began at the state and local level and then moved to the federal government. And so having that state and local experience, I was able to uh, educate my federal colleagues on that because the majority of the individuals that I worked with had never worked at the state and local level. And so with a lot of the employees, federal employees centered in and around DC, they would, sit at tables and decide, well, we'll do this or we'll do that. They didn't collaborate with other people, and they would come up with these ideas and then send those ideas down to either the regional level or the state or local level. And, the state or local level or the regional offices would say, well, this isn't going to work. Why didn't you include us in the discussions and in the decision making when you were developing this particular, high cost program? So I think being able to educate my federal colleagues along the way while I was with the federal government as to my experience at the state and local level was very helpful.
And I'll just add, one of the changes I think within the last few years is the health department really thought about its mission, vision, and values, and that's reinforced, on many calls. Also, the transparency from the top down has increased over the last few years. So I've gotten a lot of, recent hires who are really receptive to that, where our commissioner and Joanne, as our deputy commissioner, do, quarterly conversations with the commissioners where they're going over what's important in the health department, increasing awareness around things. In the Office of Public Health that Michelle leads, there's a quarterly all hands call as well. So we're hearing about our strategic plan. So I think more people are in the loop. And I think that at least I've gotten a lot of great feedback about that, especially with our newer staff members, of feeling like they're a part of the team, they know what's going on. So I'm hoping that culture will be responsive, to upcoming, graduates, and seeing that they do have a place at the state health department and that they do have something to contribute as well.
I think thinking of it not as a loss. If they're leaving for a negative reason, then there's an opportunity there to fix whatever that reason is for the person. But at the end of the day, if someone is leaving for professional development, that should be celebrated because it means you're doing something right. And then that person and you're not letting go of them forever, right? They're going to come back, they're going to provide feedback, they're going to provide mentorship. And if you have that culture where you're building out professional development, you're building out growth and change, that is going to infiltrate the rest of the division or the unit that you're in. And this is not limited to just state public health, right? This is all your organizations. And in that, you're going to continue to grow and to improve. We've changed as a country is that people don't stay in the same place for 30 years, right? There is this constant change. So I think to embrace that and see it as an opportunity to grow and to teach one another. I know in our academic meetings, we've been talking more and more about ways to not only train our current students with some of these skill sets and the soft skills, but also create opportunities for our colleagues who are already in the workforce who want to come back and reinforce or provide a partnership or mentorship opportunity to current students as they go through their, on their own trajectory and their own professional development, and how can we help with that and what can we provide for them to do that. But again, it should be something that's celebrated and acknowledged and a positive. And if you're all in this together, then that'll create a stronger foundation.
Great. Thank you for that. I have one more question for the panelists, but I do want to let the attendees know that we are going to open it up for attendee Q&A. So if you want to begin throwing your questions in the Q&A, go for it. My final question is to all of you, really, but we learned today from Maddie that roughly 20% of the governmental public health workforce holds a public health degree, which would mean that about 80% doesn't. And I'm wondering what we think academic public health can or should be doing to support or address the continuing education and training needs of that other 80% of the workforce.
I think you already have many great examples. The fact that there are workshops that can be taken, there are certification courses that can be taken, the Public Health Live that offers information and credit hours. I think those are great ways to do that. It's interesting. You'd be surprised to know I've met more than one person whose degree is English. And somehow, right, in the early part of their career, they started doing community-driven work, and their career became public health. So there are lots of opportunities in addition to the hands-on experience that you get, but I think you're a great model for finding ways in which individuals can continue to gain learning and understanding, coupled with the great opportunities in which some students were able to access a master's of public health at no cost to themselves. That's a huge opportunity that I don't know how you do better than that.
Anyone else
I
want
agree.
to?
I'll just echo that.
Okay.
Oh, I that HRSA had an award that went to several, so University of Albany and University of Buffalo got a scholarship program to kind of advance. So we've had a number of our fellows be able to get their enroll in the Masters of Public Health program, or even the Certificate of Health program, especially if they're from rural areas or other vulnerable populations, people of color. We're all of a sudden, there was a scholarship program just for them. So I know that that's kind of increased the pipeline of people still working and getting a degree, and that was successful. And then I'll just echo too, if you have a great program, let us know. So I know the fellowship program, we had a contract with Cornell to have all of our fellows take public health essentials. We were able to train over 100 local health department staff during the COVID-19 pandemic because we had that contract in place. So I will just put a plug if you have a great program that you think is a great certificate or something that would be great for the public health workforce, let me know. I know we're doing an assessment of skills under the Public Health Infrastructure Grant and are always looking to partner with entities.
Michelle, would you like to add something?
I was just going to, excuse me, mention that because of COVID, virtual training exploded. And I think that has been a very big point in trying to train people in many things, but in particular in public health. And CDC did have a certificate program for public health that I know a lot of individuals took during COVID. Mm.
It looks as though we have no questions, which means we've done an incredible job of answering everything. I do want to say that this webinar has been recorded, so we will make sure that you all have access to that on the ASPPH website. And also for our attendees who are interested, there will be another ASPPH Presents webinar on July 9th on the Healthy Longevity Framework for Academic Public Health. Thank you again, Maddie, for presenting the results of the PHWINS survey, and also to Dr. Bell and our colleagues from the New York State Department of Health. We really appreciate all the work that you are doing and look forward to continued partnership.
Thank you very much.
Thank
Thank
you.
you very much. Okay. Thanks, everybody.